Hello there everyone and welcome back to The Lovely Grind. My name is Michael Preby and my website is lovelygrind.com. That's where you can find information about my coaching, courses, and support and success monthly membership area. It's also where you can find a lot of blog posts. So I hope you'll head over to lovelygrind.com and check out that information and the content I post on that page. And I welcome you back to my YouTube channel and to today's video, which is about the topic of gaslighting and asking the question, why do doctors gaslight patients when it comes to the topic of prescription medication withdrawal, specifically antidepressant withdrawal and benzodiazepine withdrawal? Now, at first I was going to title this video, Do Doctors Gaslight Patients? But I thought twice about that because it's a little silly. We all know they do. I've experienced it. Many people I've worked with in coaching have experienced it. Perhaps some of you watching this video have experienced it. So we know it's a reality. The bigger question to explore then is why? Why do doctors do this? And by doctors in this video, I'm going to be referring to MDs and or psychiatrists. Before we get to that question, let me recap my story for you quickly. My name again is Michael Preby, and if you don't know, I was on Paxil, an SSRI antidepressant, and Xanax, a benzodiazepine medication, for over a dozen years. I was initially prescribed those medications in my final year of college for panic and anxiety, and I stayed on those medications for quite a while before, for various reasons, making the decision to get off, at which point I experienced a severe withdrawal I didn't anticipate, and that was very difficult to navigate, but I was able to push through that and experience improvements and healing, and I make these videos to share some of that story with all of you and some hope with all of you. So the question, why do doctors gaslight? First, let's look at the term gaslight and, what does that even mean? I think that term is bandied about quite a bit. Maybe people don't even understand, but in general, it's just used to refer to the process of psychologically manipulating someone to make them doubt their own sanity, their own memory, or their own powers of reasoning. And the origin of that term comes from a 1938 stage play and 1944 film by the name Gaslight, in which a husband tries to make a wife question her sanity by manipulating elements of their environment and then insisting that she's misremembering or that she's flat out mistaken when she points out some of these things that have been changed. So again, that concept of playing around with someone's sense of reality, sowing seeds of doubt to make them question what they think is true or not. Okay, so how does this gaslighting apply to the idea of getting off prescription medications and the concept of withdrawal? Well, I think a lot of times when individuals go into a doctor's or psychiatrist's office and start describing what they're going through in terms of withdrawal symptoms, whether those symptoms be physical, mental, emotional, spiritual, they're often disregarded. Maybe the doctor sees this as hyperbole and exaggeration or hysteria because the person's in a state of distress for various reasons in their life, or oftentimes the script is flipped back onto the patient then rather than the drug, and the idea is put into people's heads that this is simply a relapse of the underlying condition for which the medications were prescribed, be that anxiety, grief, overthinking, depression, etc. And this is especially confusing for the patient that comes in to tell the doctor about these symptoms and what they're experiencing, because they're already in a vulnerable state. I've talked about this a lot in my videos. When a person is going through prescription drug withdrawal, you're in a vulnerable state, emotionally and psychologically. And that's why it's important to protect what you have going on healing-wise, as far as what information you take in, who you talk to, the ideas you put in your head, and so forth. So a person is already in a vulnerable state when they're going into a potential gaslighting situation, and they're already in a state where it's very difficult to make decisions. I know this from experience. There's a lot of back and forth in one's own head. And for someone personally who already has a little bit of a tough time making decisions, when you're going through that withdrawal-induced back and forth and confusion regarding every little step you take, it can be an especially dangerous place to have someone putting questions into your head all the time, especially from someone who might be seen as a potential expert or someone to whom you're looking for advice regarding a path forward. So, person's already in a vulnerable state. They're already susceptible to suggestion. They're already in a state where they're teetering on doubting their own decisions all the time, perhaps doubting what's real and what's not. And so if a doctor is going to then tell a person that what you're experiencing isn't really what you think it is, there's a good possibility the person might believe them at the end of the day when you walk out of the office. And I think that can be a reason why sometimes people become convinced to go on other medications or to not follow through with a taper rather than to see a process through if they have the goal of getting off medications, because these seeds of doubt and the psychological manipulation, whether intentional or not, is put upon them by doctors and psychiatrists. I think back to when I was going through the withdrawal experience, and I'll share a story here that I've shared once or twice before in some of my writings and maybe in some videos as well. I never went to doctors a whole lot during that experience, and I think that benefited me, frankly. But I only went less than a handful of times. The first time I went to the doctor who was prescribing me the medications, the Paxil and the Xanax and some blood pressure medications, and I told him that I had gotten off the Paxil and what I was experiencing. And, at that time, it was just a lot of increased fear, a lot of depression, a lot of dread, anhedonia. At first, there's a lot of physical sickness, a lot of insomnia. And he told me any withdrawal Paxil-wise that would have occurred should have been relatively minor and relatively short-lasting. So what was that telling me? That was basically planting seeds of doubt in my head, saying, listen, what you think you're experiencing is not what you're experiencing. You're mistaken. There's something else going on here. What I eventually did was I made an appointment with a colleague of his at the same clinic, and it took me a period of time to work up the courage to do this. So I thought, okay, I'll start kind of fresh. Someone who wasn't prescribing the medications, they don't maybe have a vested interest in, what I'm saying about these medications. And I was going through Paxil withdrawal still, and I was tapering off of 4 daily milligrams of Xanax. And I explained to this doctor some of what I was going through. One of the preeminent things that I was experiencing at the time was severe, sharp stabbing pains in my thighs, like a type of nerve pain, as well as a whole bunch of other stuff. And what I was basically told by that doctor was that what I was experiencing were the results of stress and beer. It didn't matter that I had recently gotten off of Paxil. Didn't matter that I was tapering off a heavy dose of Xanax. What I was experiencing was because of stress and beer. And he even went so far as to put in my medical file that the reason for my visit was alcohol abuse. Not a mention of withdrawal, not a mention of tapering pills or Paxil or Xanax. And when I called the clinic to have that taken out of my record, he flat out refused. Okay, obviously that was a very disturbing scenario for me, because I was going there for some understanding, support, some guidance. What did I get? Flat out gaslit, right? Psychologically manipulated. Having someone make me question or attempt to make me question my own powers of reasoning, my own sanity, and perhaps my path forward. So, now to the question, why do doctors do this? Why in the world would they psychologically manipulate people to make them question their own powers of reasoning and their own ideas of what they are experiencing when it comes to prescription drug withdrawal? Well, I have a few ideas on answering that question, and that's what I'll go through right now. And the first of those is this: they don't know any better. Many doctors and psychiatrists simply don't know any better. They don't know any different. This is the language they speak. The language of prescribing medications, the language of switching medications, the language of adding medications. but not the language of getting off medications. Certainly not the language of difficulties involved when getting off medications. So ever since they're in school, right, ever since they're doing their residencies and then into work at maybe various clinics or whatever, they are indoctrinated to see these medications as solutions to a problem, maybe even solutions to some very outdated notions of a problem, such as the chemical imbalance theory. I know that one's still around there. So the doctors maybe don't know any better, and they're just doing what they've been taught. And so therefore they don't have the language, they don't have the skill sets to diagnose what's actually going on in the way of potential withdrawal symptoms and to offer true guidance going forward. Also, I think that another reason why doctors and psychiatrists might gaslight people with regards to withdrawal is the fact that they might be scared. They might be scared of the mess they see sitting before them, the patient who's falling apart, who feels like they're losing their mind, who's in the throes of psychological torture and physical sickness. They might be scared that somehow they're responsible for that because they prescribe the medications. And I think that thought is so much, number one, of a mind blow, they don't know how to deal with it. But number two, there's a sense that, okay, maybe this is not the time to start continuing a person down this path, but instead, let's try to cover the tracks a little bit here. And maybe even when I went to that second doctor I was telling you about, the one who put the alcohol abuse comment in my chart, maybe in fact he was trying to cover up for a colleague of his or the clinic as a whole. I was on a lot of medications, a high dose of Xanax. I was really in a bad way when I came to see him. And if he thought that in any way his coworker or clinic were somehow liable for what I was experiencing, although, legally they probably wouldn't be, but even morally, then that's probably disturbing and they just don't want to go there. Another reason why this gaslighting might occur, and I kind of alluded to this before, but the doctors just don't have the deprescribing tools, or at least they don't have maybe the motivation to learn about those tools, or even the time. A lot of clinics out there, whether it's for psychiatrists or MDs, they're cramming as many people as they can into the door. They take a very generalist rather than specialist approach. And if someone comes into the office saying, I want to get off my meds, or I tried getting off and it's difficult, or I'm already off and I'm going through these bizarre things, can you tell me why? They just don't know what to do about that. So maybe they would care, right? Maybe they'd believe you. But even if those two things were met, those two criteria, they wouldn't know what to tell you. They wouldn't know how to guide you, especially when it comes to the idea of maybe telling someone how to step down from these medications, right? And that's why myself and many people up to this point in time have had to go online and find their own way forward and fish around for information about tapering and symptoms in the dark recesses of the web. It's becoming much more mainstream now, but still not enough. Doctors still don't have the motivation or knowledge, a lot of them, to help people get off these medications. Very good at putting people on these medications, very good at switching medications or adding medications when withdrawal symptoms are presented, but not so good at helping people actually understand withdrawal symptoms or understand a taper and follow through with the process of getting off and staying off medications. So, they just don't have the knowledge. That's another potential reason why they gaslight people who come into their office, intentionally or not. So, the bottom line for you, the person who might be going through withdrawal or trying to taper off medications or have the goal of reducing medications in your life and getting more naturally healthy and well, the take home from all this is you can't allow others to sow seeds of doubt into your mind as far as what you're going through. Now, that doesn't mean you don't take advice from trusted advisors, especially people close to you who care about you. But at the same time, don't allow yourself to be psychologically manipulated to the point where you're questioning your own sanity and your own decisions all the time. It's a lot of times you haven't been going through these things for a day or even a week or sometimes even a month, but you might have been experiencing symptoms for multiple months or every time you try to come off these medications and so forth. So you have a good idea deep down in your gut of what you're going through. If you want to make it a goal of yours to taper off these medications and get off them and stay off, then you have to believe yourself and learn to trust your intuition a little bit and trust your path forward instead of always seeking guidance from some of these people who might not have your best interests at heart or might not have the knowledge needed to give you the path forward that you desire. So, yes, there is gaslighting that goes on with regards to withdrawal, and psychiatrists and MDs more and more, I think, are getting knowledgeable about this topic, but still not enough. So, know your situation. Try to, for yourself and with your loved ones, plot out a path forward, and then be resolved to see it through without allowing others to sow those seeds of doubt in your mind all the time. My name is Michael Preby. My website's lovelygrind.com. I hope you'll go there, find information about my coaching and courses and membership area, check out my blog posts. I'm glad you're at this YouTube channel. I hope you keep coming back to these videos. Until next time, please remember to take care of yourself and your dreams.